Testing 1.
Testing 2.
Testing 3.
Yeah.
Just like, is that what I'm meant to be doing? Okay, good.
Yeah.
Excellent.
Welcome to the Testing Podcast, everybody.
Welcome.
And welcome Dr Anand Patel.
Hello.
We've got like a media man
God, don't
in the
say
studio. I
amazing.
kind of
We've got a more media man than us, isn't he?
I know.
A proper media man.
yeah, he should be telling us how to
I did try, but understandably, this is all you've got. So we are where we are.
But this is awesome. Thank you for joining
No,
us.
lovely to come in. Lovely to be in Reading on a sunny
Welcome.
day.
Was it sunny?
It's
It was
lovely.
foggy by the time
Break
we
that
came in this
in a
one.
lovely studio.
It's cool, isn't it? Yeah.
Fancy.
So, you're the only man sat at this table, and if Mike was here as well, you'd still be the only man that see me running around naked on Brighton Beach.
That's true, actually. I've seen
I
a
haven't
lot
seen
of
that.
people, but yeah, I was. I didn't particularly know you that well at the time, so I don't have you emblazoned on my memory.
That's good.
However,
I
there
don't
is-
think you knew me at all at
no,
that point.
no, no.
But
I think there is footage of all of those men on the beach. And what was particularly interesting is they did a drone shot of it. And I found out a few years later that the reason they didn't use a lot of the footage is because the drone shot basically has loads of bouncing tackle going down the beach rather than it was meant to be filmed from the other way
Behind.
and just had buttocks bouncing.
Fantastic.
So they can't use much of the... And I was like, oh, that's really disappointing.
yeah. A
But it was a very
October
cold
day.
day, so maybe it would be disappointing for everyone else to watch anyway. So it is what
Should
it
we
is.
give that some context now?
Yes, sorry, yes.
Yeah,
Generally, I was
what
watching
this
lots
again?
of men running around naked on Bright Beach, which, to be fair, isn't necessarily the thing that doesn't normally happen. It doesn't have a nudist beach.
Yeah.
But it was we were doing a TV show called Celebrity Save Our Sperm, and we had 3 celebrities. We had Melvin Adoom, we had Russell Kane, and oh my god, I'm feeling embarrassed now. Ollie Locke, and they were getting their kit off and swimming in the sea on a very, very, very icy cold day to raise awareness. I think they initially tried to do it as the world's biggest skinny dip for a Guinness World Record, but unfortunately, trying to organise things with the council and police and all of that was just like a lot. So they just got a lot of really lovely fertility men, and they had lots of lovely couples with holding their babies on the beachfront, all covered in blankets, obviously, whilst these mentalists ran into freezing water.
And Ian being one of them.
Yeah,
Exactly right.
With the bobble hat though, the bobble hat made it
It's
onto
important
TV.
to keep the big head warm.
Yeah.
I love that.
Yeah.
I don't think I'll ever get that scene out of my mind.
Yeah.
It was quite amazing. I was going, you're all insane. But also what I found out at the end was they were planning to grab hold of me and take me in the water with them,
Oh,
which
were
I
they?
would have been utterly furious at. I was wearing a beautiful Dries Van Noten coat and I would not have been happy. Plus also apparently I had several £1,000s worth of radio equipment
Get on
attached
you.
to my body.
And your megaphone, you stand there with
Yes,
your megaphone
it was,
as well.
yes, there was a megaphone moment. It's like being a school teacher again. Line up, but like to 35-year-olds with their nuts out. It was very unusual.
It was fun.
What an intro to the testing podcast
Yeah, yeah.
this morning.
Yeah. Balls again. Here we are.
Should we now find out a bit more about you, other than the fact you stand around on Brighton's nudist beach with a megaphone? Who are you, Anand? What do you
I
do?
am a GP by training, and now I get to work in doing male fertility, male sexual function, testosterone replacement, work for a great startup called Manual. So doing loads of men's health and work as an NHS GP.
Blimey. And,
Awesome.
Where do you get the time to stand around?
I'm very siloed, so I've got I do different jobs on different days, which makes it a lot easier. So Friday is my day of rest, and I
Yeah.
get to come and have a conversation like this, which is lovely.
Yeah, I'm so pleased you made it. It's kind of like been dying to get you in the studio. And
I
it's kind
think
of,
places are much further away than they actually are. So I thought Reading was literally probably where Lincoln is, and therefore I was like, it's too far for me to come.
Yeah.
But now I've braved driving because I'm like an old. I very much like other people to drive me around. I would have been so good as a sort of dictator, or someone's very, very independently wealthy, but sadly I'm not.
in
So you're gonna
another
drive-
life.
Yes,
Drive
I've driven here in a Skoda.
Skoda's a good car.
Yeah,
so I think
good cars, but not demeaning Skoda, but not fancy pants when it comes to cars.
yeah,
Unlike you,
Well, I like my cars.
Porsche.
yeah. That's not his car though. Just drives it
Now,
and crashes it.
me. Don't demean the poor guy.
So very much a specialist in men's health,
Yeah.
aren't you?
Yeah.
So. And is it more latterly into fertility, kind of off the back of Save Our Sperm, really, wasn't
Basically, yeah. Jonathan Ramsey, I'm sure lots of you have heard of, lovely, incredible human being. Basically said, you've been interested in this area, and I was like, actually, I really am, because I've done so much work in sexual function, so much work in testosterone deficiency. I'm like, well, actually, if the balls have 2 jobs and one's testosterone and the other one's sperm, why don't I know very much about sperm? So maybe I should learn a bit about that. And having done that, I've just realised how little people know in general about male fertility. And certainly, I didn't get, I had an hour lecture on testicular function in medical school, but that was, I think, in 1996. So that feels like quite some time ago. And then I had no training in male fertility or anything like that, or understanding of it in my GP training, my hospital training, any of that stuff. So it was very much having to learn it, one, at the European Society of Sexual Medicine training that I did to get my sexual medicine qualification, and then latterly just, meeting up with Jonathan and working with him in his clinic, then going to all the conferences, doing loads of reading and trying to work that up, and now latterly trying to develop fertility services and talk to people like you, working with other charities, trying to go, actually, why don't people know about this? I'm lucky enough to curate the Royal College of GPs Men's Health Day, and part of that now we're going to make sure there's men's health in terms of fertility in every year, because we did a 100-person just quick sort of questionnaire. How many of you know about the male fertility? And 80% said they'd never had any training in it. And these are established GPs. And would you be comfortable examining varicocele, which is like a very commonly found cause of fertility differences? And 97% not really. And this is not because people can't do their jobs. It's actually because you've never been taught to do it. You've always been taught it's the woman's fertility that is prime, and you need to have that as your main focus. And that has definitely been true. But as men's sperm counts decline so dramatically, and they've dropped, I'm sure you've saw it before, 50% in 50 years. And if that's happening to your testicles, if there's two sets of factories in there, aren't the other factories that make your testosterone also probably working less well? Which is why in my job with Manual and with the Testosterone Clinic Centre for Men's Health I work with, we've definitely found we've got so many more younger men. So, we used to have mostly 50 plus people coming to see us, and now we've got 20-year-olds, 30-year-olds. There must be something about our environment that is, and potentially it's in the womb, that is actually damaging our reproductive function from before birth to now, and that's why we're both genetically and environmentally susceptible to these changes. So it's fascinating, but it's also kind of like, if we're on the same track to become potentially like, functionally infertile by 2045, don't we need to be looking at this?
Yeah, it's quite urgent, right?
It's really urgent. It's really urgent.
That's crazy, isn't it? Yeah. So the people you're seeing in your testosterone clinic are these people that are now, testicular function's not as good as it should be.
Absolutely.
But they're 2-3 decades younger than the standard patients you were seeing before.
Absolutely, and and when we do semen analyses on these people, because we want to make sure that they do have a sperm count before they get given any sort of supportive testosterone therapy. Because weirdly, you need good high testosterone levels to make sperm. However, if you give someone external testosterone, it switches off their own testosterone production within the testicle, which is why sperm doesn't get made. And so in the past, doctors used to give patients testosterone to try and improve it, because that surely makes sense. But unfortunately, all of these people would turn out infertile.
Yeah, it's counterproductive. Isn't
Exactly.
it?
Yeah. So it's trying to educate patients that the fact that sometimes they want X type of treatment, and you're like, but you also want kids the next 2 years. I can't give you that on its own. I've got to give you something to support your testicle function, because otherwise it will switch it all off. And it can be quite challenging to like, but I've read this. And you're like, yeah, but what you read on that Reddit profile, I do lots of reading on Reddit. I was reading a Reddit thing on LG TVs because I'm thinking about buying a TV, and I love the geekiness that goes into it. But sometimes it's like all the sources of information aren't the same value or quality.
Yeah.
And that kind of is something you hopefully have to explain to people in the right way.
Yeah, because information is dangerous, right? If you've not got, it is dangerous, right? Isn't it? If people make the wrong choices. And I think youths anyway. I remember talking to Jonathan Ramsey about how there's an element of population among our kind of younger generation that are trying to make themselves look more sexually attractive, but actually what they're doing, they're harming their sexual future performance of having children, because obviously they're basically just killing their testes, aren't they? And it's quite scary that's.
Well, because I am on Instagram, and I look at. Obviously I am almost 50, so my view of Instagram is very different. I was very lucky to grow up without anyone watching, which was lovely. There's me being drunk as a medical student. There is no documentation about any of that.
There'll be some stories.
Well, exactly.
There'll be plenty of stories.
But it's in people's memories, but no one can prove it, which is exactly what you want, really. You want to be able to make mistakes. You want to be able to screw up. And also you want to be able to be spotty and whatever, and not necessarily have everyone document your less good phases of your life. But actually, I can imagine if young people are growing up and they are being absorbing all of this, like people who've got these beautiful faces, sculpted bodies, etc., and often they have been sculpted. Sometimes it is work. People have put in the effort of going to the gym, etc. And sometimes they have done both. You don't get decent body often by just doing the sculpting. It takes a lot of work to do it, a lot of time to do it, a lot of money to do it. And I know if you're like me, my mum, dad fixed windscreens, my mum did directory inquiries 192. That sort of money isn't available to you. You don't have the money to have filler in your jaw, or to have a nose job, or to have waist cinched, or whatever it is. And actually, I think watching things like Love Island, watching things like those programs that kind of focus you on body shapes and body types and make you think that I'm 16 but I should have the body of a 25-year-old that's actually been on steroids for a little while. I'm saying that they necessarily are or they aren't, but actually these people have been honing their body for years and they've probably got relatively adult bodies, and you're comparing your developing body to that. I don't think that's
there's a huge social pressure, isn't there? I mean, growing up as a kid, I got bullied for being ginger, and I could go home and switch off from it. But youngsters now, when it comes to that social pressure, it doesn't stop when school finishes. In fact, actually, it's probably worse when they go home, isn't it? And that's it's a weird tangent to fertility, isn't it? But like it's a real thing, and people are doing the wrong things to make themselves.
But also, it's the stuff about we focus a lot in sex education in schools about making sure that people don't get STIs, and we make sure that they don't get pregnant. That'd be the worst thing that possibly happened to you. We never talk to them the fact that actually it's probably going to get more and more difficult for them to get pregnant over the next 20 years. So perhaps they want to think about that, and also thinking about the structure of relationships, and no matter what your type of relationship is, and whether it's polyamorous or whatever. But actually, how do you manage a relationship? How do you manage disagreements? How do you manage consent? How do you manage? And I know that consent has become more of a conversation in schools, which is great. But telling young people that actually your fertility may be declining after the age of 35, and therefore, it will be declining after the age of 35 if you're a woman. And with a guy also, at 50, you've got half as good sperm and half as good numbers as you had when you were 30. So it does matter. All these oligarchs and billionaires having their children in their 80s with their younger partner.
With their 20-year-old wife. Well, that's why they're getting away with it.
Some of those 20-year-olds may have had young enough eggs to support the less high quality sperm of our gerontophile. No, it's not geriatric billionaires. But at the same time, most of them will also have had a fertility treatment, won't they? And I think the fact that we are shy of talking about the fact that some people need support, I think is problematic. I'm interested to have these conversations, interested to think about young people, because I used to be a school teacher, and so thinking about what they learnt in PSHE and sex education really, and what that needs to be now when it's a completely different environment. I was teaching when I was 27, and that was 21 years ago. If you think about social media now versus then, it was very much in its infancy then. I'd only got my mobile phone 3 years before that. Whereas now people have grown up with mobile phones their entire lives. Their parents give them to, when they're in the waiting room of a doctor's office or whatever, to keep them a bit quieter. I totally get that. But equally, it's a fundamental part of their existence. Their sex ed is often from porn. Or from the stuff that they're watching there. And they are learning some helpful stuff, perhaps sometimes, but they're also learning some quite aggressive stuff, or that they're often looking at pornography and kind of going, oh, my body doesn't look like that. My penis size doesn't match, my labia don't look like that, my breasts don't look like that. And I've had patients come in going, look, there's something wrong with my willy. And you're like, okay, let's have a look at it. And I'm like, can you just point me to what's the problem? And they were like, that bit at the tip is like, that's your foreskin. And it's like, what do you mean? It's like, that's your foreskin. It's like, yeah, but most people don't have that. I'm like, okay, so what have you been watching? It turned out it's been mostly watching American pornography. And therefore, the most men in America are circumcised. He had no idea that wasn't meant to be there, or that was meant to be there. And so it was just like, oh, but do we not need to get rid of it? I'm like, well, it's 20% of your sexually sensitive material. So, if you do want to get rid of it, that's up to you. But equally, you'll be potentially having a little bit less sensation and fun compared to what you've currently got. And I'm not saying that people who are circumcised have less fun, because actually overall they've marked them, sex is fun for everyone. But equally, if you're getting rid of 20% of your sexually functional material, I would not consider that a bonus. unless you need to.
for no real reason.
Yeah,
right?
like quite. And
there's medical reasons to get rid of it.
Yeah, exactly. They absolutely are, like
reasons.
for most and stuff. But actually, I think it is. Why is it not mutilating to take sexually sensitive material off a man and not and to do that on a woman is female genital mutilation? I think it's absolute nonsense. Cutting the head of the clitoral tissue, which is basically the foreskin of the clitoris, is considered grade 1 or the lowest level in inverted commas of female genital mutilation. But taking off a man's foreskin is considered absolutely fine. And I think that's absolutely abhorrent and a complete double standard.
Yeah. Blood, we have gone off on a tangent.
Crikey,
Sorry.
yeah.
What did we say before we started?
Yeah.
Wind him up and send him off, and off he
Sorry,
goes. No, but this is
off I
brilliant.
go.
Yeah,
Off I go.
Can
Sorry.
let's go back to your men's health clinic. So because this is that's been established for quite a long time. That was your specialist area. That, like you say, there is a crossover with fertility, but fertility's in some ways relatively new for you, if I can say that.
Yeah.
So what sort of patients are you seeing in a men's health clinic?
So, generally it would be about sexual function and testosterone deficiency. So that would be people who've noticed a reduction in their libido, so sexual interest. So they just don't fancy people as much as they used to, or they don't find their partners as attractive as before, or they're just not sexually interested at all. Otherwise, they'll have erection problems, so difficulty getting up. And sometimes it's intermittent, other times it's pretty persistent. The thing that we really try and promote is, if you're losing your nighttime erections, that's a really important marker. That is a marker of both. Because nighttime erections, all young guys are kind of like, I get loads of erections, and they're talking about how it's clearly a sign of how horny they are. It's nothing to do with that at all. It's all about penile housekeeping, basically. You get an erection of sorts generally in men every sort of 45 to 60 minutes at night, and that's generally just to flush the penis tissue with oxygenated blood, because otherwise it just sits there hanging with low oxygen level blood. And if these tissues aren't stimulated with high levels of oxygen, unfortunately the body thinks, well, what is this useless appendage? And if 3 to 6 months of disuse, you're actually going to get scarring, cell death, and most people don't want a smaller scarred penis in general. So it's really important to kind of go, look, if you've had a breakup, if you've been depressed and therefore you're not sexually interested and actually you've lost your nighttime erections, it is a bit use it or lose it. So, do give yourself a helping hand just to get the blood in there. That's absolutely fine. And if those nighttime erections start to come back when your mental health is better, great. However, if they don't and it's persisting, go and see a doctor. Is this a sign of cardiovascular disease where your heart and blood vessels aren't allowing blood to flow into the penis? Just think of your willy as basically an inflatable balloon sock of blood, and it's attached to your heart and blood vessels. So if the blood's not getting in there, is it because of your blood? Is it because of your brain, because you're anxious, you're stressed, depressed, or whatever that's going on? Or is it because of your hormones? Because there's not enough testosterone to kind of drive the system. So and that's the final thing I do is testosterone deficiency, where people often come in, and it can be at any age, feeling like they've lost their mojo, like someone's turned down the colour in the world. Often they've been treated with antidepressants because they thought they were depressed, and understandably mental health support in the UK isn't necessarily as easily available, and they find, well, it might have done something, or maybe it did nothing, because it's not necessarily the type of depression that true depression is. It's more like, I just don't feel like I live in the world the way I used to do. You lose a bit of your swagger, a bit of your drive, your focus, your motivation. That kind of just diminishes, and your sexual interest. And lots of men just go, well, I'm just getting a bit older. This is what aging is, right? But actually, in lots of cases, it isn't. It is due to low testosterone. And we think, by 2045, half of all men in the UK will be 45 and over. 4 out of those 10 men will have low testosterone levels. So that's approximately 7 million people in the UK.
It's quite big, isn't it?
That's a huge
Yeah,
issue.
by 2045.
Bloody
And lots of them will be more infertile also by that time, because our sperm
depressed,
counts.
cardiovascular disease.
Yes.
Wow.
No erections.
Yeah. Some people might be happy that there's the men wandering around with less erections.
That absolutely might be. But I think that's the other thing is, like, are you doing testosterone therapy because you just want to go, have a legion of horny old men? I'm like, no.
It's not exactly it.
No, because obviously that is not the visual, and I don't not necessarily want to be like the sort of poster boy for gerontophile sex. But equally at the same time, I would like to be having sex as I get older. And actually, if it is because of a disease state, which low testosterone deficiency is, then I think it's important that we treat it. We know that men die sooner if they've got diabetes or cardiovascular disease and they've got a low testosterone. We know that they're more likely to get abdominal fat. If they've got more abdominal fat, like it's greater than 102 centimeters around their belly, then they're at risk of 22 more cancers than other people. They've got an increased risk of 5 times more of having diabetes, 3 times more of having colon cancer. And so all of these things interact. It's not, that's why I love being a GP and then doing men's health and then doing sexual function and doing fertility, because it all makes sense in my head. It's like it fits.
Yeah.
It's weird, I think, that some people just do one thing. And obviously that's a GP speaking. Obviously other people do really well specialising in a specific area. For example, if I had a stroke, I would want to see a stroke specialist. I don't want to see someone about their todger, who specialises in willies. That's just not going to help. But equally, I like having a background where I'm quite inquisitive about lots of stuff, and having to be a school teacher and trying to explain facets of biology and health to young people who often are like, what? Yeah. Either out of disinterest or just because you haven't explained it clearly, or they just don't have some fundamental understanding. And when they get it and it clicks, and like, oh, but that means this and that. I mean, I remember explaining the structure of the vulva in a sex ed lesson, and like the boys suddenly turned around to me and went, "Do you mean she's got a mini knob?" And I was just like sat there going, oh my God, I'm going to get fired. And then I just thought about it going, well, suppose the clitoris does have a hood, which is the foreskin, and it's got a body and it's halved around the sides of the vulva. So yeah, you're right. You're totally right. And it was just one of those moments where you get taught loads as a teacher. One, humility. Because they just embarrass and rinse you just all the time. It's so humiliating. So you do have to have a nicely open sense of your ego. But equally, you kind of go, oh, actually, I hadn't thought about it in that way. And it's really nice to have that fresh view of young people kind of going, yeah, but obviously.
Yeah.
Anyway,
why hadn't you thought that?
Yes, exactly. You're an idiot. You're like, well, maybe.
Yeah.
How did you go from teaching then to this point? That's quite curious about your.
I was a doctor first, so I was doing my hospital jobs. I did, unfortunately, I did two really, really miserable jobs, one after the other. So it's about a year of feeling really sort of depressed, basically.
Right.
I was unfortunately I was doing a job where people were in extreme health conditions, and I would only see the ones that either actively dying, or that they'd be in for a day and then go, because they'd have a bit of their treatment, which I'd give them.
Right.
And so in those departments, I wasn't also doing external clinics, so I never saw anyone get better. So I basically spent a year amongst the sort of dying or semi-dying, and I was also very much on my own, and there wasn't very much a sort of team at my level. So there was a team above, but not really at my level. So you kind of just got quite lonely and quite depressed.
That's hard.
And so shout out to my lovely pharmacists, Kingsley, for basically walking me through that. Thank you. Basically, my pharmacist on the ward became my best friend, and we just walked around today and totally saved my sort of working existence there. But I decided that I just don't want to be miserable. Yeah. And I'd always wanted to be a school teacher. I didn't want to be a doctor when I was young. My mum and dad wanted me to be a doctor, but I wanted to be a school teacher. So I applied to do a PG cert, and they said, you can't, you're too late. But they said you can do a GTP, which is kind of like this apprenticeship thing where you teach Monday to Thursday, and on Friday you go to university to learn how to teach, which obviously, but that's how some jobs work. And so I knocked on the door of the school next door to the hospital, because that's all I could visit in my lunch break, which happened to be Brighton College, private school. And they were like, are you here for the biology job? And I was like, no. And so they were really lovely and took me around, showed me the department, and they're like, look, why don't you apply? You'll never get it because you've got no experience, but it's just for the application process. And I got the job.
Wow. Wow.
And I ended up being a biology teacher at Brighton College, which is very fancy now.
Without a teaching qualification?
Yeah, which I did. Well, I taught Monday to Thursday on Friday.
Okay.
How cool is that, though? That's so cool.
Yeah. No, I mean, obviously, I was delighted. I was very lucky. I mean, this was a long time ago, 20 years ago. But it was amazing, and it's still to this day probably one of the best jobs I've ever done. It's brilliant.
So how did you end up back in medicine then?
Because there was something called MTAS that was modernising medical careers. They always try and modernise medicine every so often, and so that they could then send you anywhere in the country. If you went back into medicine, also you'd lose all of your previous accreditation. So I'd been a teacher for 2.5 years, and then this came in, and two of my lovely consultants in the kidney ward that I used to work on rang me up and said, look, if this goes through, you will have to retrain entirely.
Whoa.
If you don't finish off some form of training. You can still go back to teaching then, but you need to do it now. Yeah. So I did, luckily enough, I had done so much that I just needed to do 6 months of gynecology, and then I could do my year's GP training, and it was done because I'd done a lot of the previous jobs. So I did my GP training, came out of that, was a GP, liked the fact I could pay my mortgage, because previously I couldn't pay my mortgage with my teaching job. So I'd have to work in A&E all summer and all Christmas and stuff. Like whilst my mates were going on holiday, I'd be like, right, I'm just middle of A&E. which is, I like working with my colleagues, but I was just like, I needed something else. So I could pay my bills, which was lovely. But you can't be a GP and teach at the same time. But I did end up becoming a trainer for doctors. So I became a local program director for GP training in Worthing.
That's proper fascinating.
Yeah, cool.
What a lovely story. And I guess really it makes you super rounded because you've actually worked in an environment that's really challenging. Anyway, teaching is obviously very challenging but rewarding. But it must make you such a rounded person because you've got so much.
That's very kind. I mean, I don't have much patience for being miserable. So I'm like, actually, I do recognise why people stay in jobs, why they stay in relationships that they can't otherwise stand because they need security or they need I get that. But actually, if I'm in the position where I don't have to be miserable, I can't stand sitting around people who have the ability to change, have the opportunity to change, and just like, but no, I'll sit and no. So that wasn't for me. And so actually, I'd much rather not be in miserable situations and change out of it, even though, the first day of walking into school was absolutely terrifying. I've never known anything like it. Just absolutely terrifying. And the first and in some ways it wasn't because I had no idea what to expect, and also because I'm generally quite optimistic, weirdly. Yeah. And I sort of just turned up and went, la la la, I'm going to be your skill teacher today. I'd written 47 PowerPoint presentations on enzyme biotechnology, on all of this kind of stuff because I'd gone through the syllabus in advance. I played the kids like a 30-minute presentation, which I'd just done on enzyme biotechnology. And at the end of this 13-year-old sticks up his hands, goes, "Sir, what's a protein?" And I'd been talking about activation energies and all this kind of thing. And I was like, you idiot. You've got absolutely no understanding of what their level is. You don't know how to teach. This is not ideal. Yeah. But it was brilliant. The kids were really patient with me, and I loved them. I thought they were brilliant. They were irritating and exhausting and frustrating. And when you have a room of 25, 15-year-olds turn on you, that is absolutely horrendous. Yeah. But equally, it was brilliant.
That's awesome. What story?
Yeah. No, sorry, random. No, off topic. Sorry.
Yeah. Right, so back to your men's health clinics then. So are patients self-referring, or is this an NHS clinic?
Unfortunately, even privately, you don't get funding for men's health in general. I mean, yes, in the NHS you can go and see a urologist, but generally privately your insurance doesn't cover it. And lots of testosterone therapy and the ranges that people treat within the NHS are often lower than the level at which someone might have symptoms and might feel improvement if they were treated.
Right.
So that can be problematic. So say, for example, arbitrarily, you've got a total testosterone of 15 and below. We've got sort of lots of articles that say you will likely feel symptoms. The problem is that the treatment boundaries for some practices is like 8 and below. So there's that big, no man's land.
That's a huge
It's a huge window, right? Yeah. There's a huge number of people that will have symptoms, and sometimes they lost their jobs because they're not spatially aware anymore, or because they feel exhausted all the time. They're falling asleep after their lunch break. So we do have patients coming that have had performance reviews because actually things are going really badly, and then you kind of go, well, maybe it's your testosterone, and you replace it. And the idea is it's not testosterone for everybody. Actually there are people that can't have it because of medical contraindications. There are people that shouldn't have it because actually it probably isn't the thing that's causing the problem. It's probably the fact that it's their awful job, or the fact that they're kept up at night several times because they've got 3 kids under 5. There's lots of reasons why, or recent COVID, which has damaged their testicular function, and hopefully that will come back. So we're not trying to flog it to anyone, but the idea is actually if you are low and you have what sounds like really good symptoms, and there's loads of questionnaires online like the Adam questionnaire, etc., that can kind of review those. And if you do get treatment, usually within 3 to 6 months, most people feel significantly better. If their mental health gets better, their strength gets better after 6 months or so, their bone density at 2 years, their libido gets better pretty quickly. That positivity and sense of swagger gets better pretty quickly. And so people just kind of go, look, I didn't think I could feel like this again. I thought this was lost to me. And I feel it's incredible that we are learning from what menopause is happening. People like Davina McCall, Louise Newson, etc., making sort of noise in the community about what it means to women at work to have support. But actually, I would also advocate, because it's not, it doesn't have to be us and them. It's all of us. For men having support. If you're over 40 and you're feeling more tired enough, get your testosterone checked out. I mean, obviously, look after your health and do all the other stuff, and try and get your sleep in order, and don't eat just kebabs, and stuff like that. But because obviously that isn't going to be good for your health either, and that might be the reason. But if you can't do it through lifestyle, absolutely, is there a medical cause of it?
Yeah, and there's so many men won't know this, won't think about this at all.
I feel really sad for them, because men tend to not see their GPs between 20 and 50. because they don't generally have to. Women are more likely they're going to go in more likely for their smears. So they're going to be going at least every 3 years potentially to be seen by someone, and then be able to ask a question like, oh, by the way, can I talk to you about this? And then they perhaps get an appointment. Or they're more likely to go in with their children than men are, just in general. And men are more likely to go in later, and after the disease has been present for a while, while their mole's been getting bigger and they've been ignoring it, that cough's been getting worse and they haven't paid any attention, that lump has been getting worse and they don't, it's frustrating that, a lot of our male behaviour is based around sort of outdated things about masculinity, about wanting to provide. And do you know what? Men are forced into that role in some ways as well. If you are the one that has to provide, when do you actually feel you should take the time to look after yourself? And actually, I would argue that taking care of yourself allows you to provide more efficiently and more effectively. But
you just do that blokey thing of just, I did tomorrow. I've got other things to do. I need to fix this, not me.
Where's my screwdriver?
It's true though, isn't it?
But also, work doesn't necessarily allow you the time off, right? Like, it's not that you can jump off your train and kind of, give me a couple of minutes, I just need to pop into my GP's office, right? It just doesn't happen. No. And so if you're working the shift work, particularly that you're doing, how is it going to be possible for you to book those appointments and things like that? So, I do think it needs to be more of a national conversation about how do we support people in the round about their healthcare, about being not only understanding more at a young age and understanding about diet, nutrition and exercise and the value for all of that. But I think it's so short, so close-minded that, lots of people, football pitches and their PE services are being limited. And you're thinking about actually, young people learning to exercise is probably one of the best things that they could ever do. It will help their mental health, help their physical health, their sleep, all of these things. And we're discouraging it. Discouraging. Thank you very much.
Discouraging. So there'll be some men that have listened to some of those symptoms that you've just listed, like tiredness, bit depression, lower libido. They're listening to this and they might be trying to conceive at the moment, but they're thinking, hang on, that sounds like me. Maybe I should just go and get some testosterone from somewhere.
Please do not get testosterone for your mate Gary at the gym. That will not go well for you. So as we talked about before, like if you get external testosterone, your brain recognises, oh look, there's loads of testosterone about, and therefore your brain basically is signalling your testicles. It's a conversation all the time that's going on in the background, and it's managed. So basically, your brain releases two hormones, which are FSH and LH. FSH is important both in men and women. FSH tells your testicles to make sperm. LH tells your testicles to make testosterone, and you need both to make sperm. Now, once you've got good amounts of testosterone, good amounts of sperm, they release chemicals that feed back to the brain, and the brain goes, okay, there's a decent amount of testosterone, decent amount of sperm. Let's keep this conversation going, but I don't need to shout at the balls quite so loudly. But obviously, if you stick a whole load of external testosterone in, the brain goes, look, there's loads of testosterone.
We're all good.
I'm going to stop talking to the balls. And the balls go, I'm getting no signalling. Therefore, I'm going to shut all my factories down and your balls will shrink. So therefore, it is not a good idea, please do not do this, of taking external testosterone sources unless you have discussed this with a doctor who specialises in fertility and testosterone supplementation, because we get a lot of people who've gone to testosterone clinics where they haven't considered people's fertility. So it's really important to be thinking about, have I had a conversation about fertility safe or fertility safe as possible treatment? And the other thing I want to mention is the use of hair retention products, because I lost my hair when puberty hit. Like I have the most sensitive follicles, so literally I was balding at 16, which I will tell you now is not the dream. So I was losing my hair then, and kind of thinking, why the hell is this happening to me? Obviously now I understand that actually higher testosterone levels get turned into DHT. DHT is an active testosterone analog, which kind of works on the scalp, and it causes minimization of hair follicles.
Really?
Yeah, in people who are destined to lose their hair. So clearly I was genetically in the womb destined to lose my hair. But the majority of people start to lose their hair from 25 onwards. And lots, you'll see lots of men in their 60s that bald. But obviously the day of the hair transplant has come along, which is brilliant. I would definitely have had a hair transplant. Now I'd have to literally have my chest hair implanted. I've lost my hair so much. But things like finasteride, things like minoxidil that people are applying to their scalp, they're getting online. They're getting from a lot of these clinics, which are very valid, very supportive, very well managed medical clinics. The problem is, if you haven't been discussing your fertility wishes, that could be a problem, because longer term use of these chemicals like finasteride and minoxidil can change the hormonal function of your body. They can also cause changes within the testicle itself and within the prostate. And everyone's like, well, what does the prostate matter? Well, the prostate basically is a large sort of gland that makes the nutrient broth that your sperm hang out in. Now, nutrient broth obviously sounds minging. However,
Slap that up.
exactly. Well, that's some people socialise. But the issue with the nutrient broth is it neutralises the vaginal environment. So because the vaginal environment is acidic for a reason, because it protects against certain bacteria growing there.
Yeah.
So it neutralises the vaginal environment so sperm can survive in there. It's got lots of positive things like zinc. It's got fructose. So loads of things, chemicals that allow sperm to survive up to 7 days within the female genital tract. Whereas, if you masturbate into a tissue, that's going to last 30 seconds or a minute and it's going to die because it doesn't have the correct environment to survive. So actually, if you have a medication like finasteride, for example, that potentially over time is going to damage how your prostate works, and therefore you're going to make less of the nutrients that go into that make less of the fluid, the seminal fluid, then actually you're potentially going to worsen the ability to neutralize the environment. You're going to worsen the housing, the nutrients that are available for you to get the sperm on their way to their goal, which is hopefully meeting an egg. So it is a problem that people aren't aware of this, and this is why we're working really hard to try and make sure people are educated in this area. And this is why it's great that you guys talk about all of this so much with such a variety of people, because everyone's got their view on this, right? And everyone's got their angle and everyone's got their ego and all this kind of stuff. But you're just like, actually, just let's put it out there. Exactly. Yeah. Let people know. Let's educate them. Let's just shatter some taboos. Let's just talk about the fact that yes, you might have your erectile dysfunction. Just talk to your talk to your colleagues. Not to your colleagues, might be weird. But exactly.
Jump onto Teams. Right, about my erectile dysfunction.
God, can you imagine that Zoom call? Slightly uncomfortable HR. No, but I totally get it. You talk to your best friends about it. Yes, they might laugh at you. Of course they will do. That's part of the nature of being a guy. It's to laugh at your health conditions. Whereas actually part of it also is relieving to unburden yourself. If you're having a fertility problem, it's great that you guys have your support groups. I mean, good Lord, can you imagine the number of men who just sat there going, I'm infertile.
Yeah, what do I do?
I know, I'm on my own. I'm the only one. It's only me.
Exactly. And Jonathan Ramsey talks to me about, like, actually when we're breaking bad news, and obviously in general practice you do that a lot. Maybe someone's got cancer, they've got had a heart attack or something like that. But actually, when you tell a man that he has no sperm in his semen sample, and it has been a dream of his, for several years with him and his wife or whatever, maybe it hasn't been a dream for that long, because often men get encouraged into recognizing that actually they do want children. But actually, it is something that makes up his masculinity. You being able to ejaculate these days, and the volume you ejaculate has become a thing.
Oh, I bet, yeah.
Do you see what I mean? So these are both fetishized in terms of sexually interesting to some people, but also they are kind of like, well, that makes me manly because I've seen it on a porn.
Yeah, I can get it halfway across the room.
Exactly. Or it's liters, and you're like, it's not liters. It's clearly someone has Johnson's baby stuff, which they've squirted by the side via a tube. I mean, the average is about 2 to 5 mils, guys. If it's about 20 mils, it probably didn't come from there. Do you know what I mean?
We hear all too often in support groups, is the first time they ejaculate a cup, they just go, "Is that it?"
Yes.
Because
Look,
we have one to hand.
I mean, to be fair, that's quite a big cup. And
that's a huge cup. It's 125 mils.
It's 125 mils, mainly because it's the opening, guys, because men can't even pee straight. So you're imagining trying to ejaculate, that's why the hole's that big, because frankly, you don't need all that space. You probably just need the base of that. But if it's like 5 mils, that's like a teaspoonful. And then obviously, if you're watching pornography and it looks like a litre, where do you think that is real? It's not real.
I'm loving this conversation because this is all about breaking taboos and stigmas, isn't it? And educating the masses. But
I apologise. It's also quite night smooth thinking. I'm quite tangential.
No, it's great because this is exactly what we're about. Is having these open conversations to break these taboos. It's so important, isn't it? Because there's so much misinformation out there on social media, etc. These conversations need to be had. They really do.
How many of these conversations are you having with your patients week on week?
God, all the time.
Like, testosterone therapy or anabolic steroids, protein shakes, finasteride. Is this kind of a weekly?
What's lovely is that I get to talk about it now all the time, which is great. But equally, I recognise it's not necessarily being talked about on a day-to-day basis in GP practices, in schools, in health clinics, online, in Reddit groups. Because, when people are worried that they're losing their hair, for example, because I recognise it's a really big thing. It's a really big. I didn't realise how big. I had terrible hair when I was a kid. I used to like the Incredible Hulk's hair. It was awful. But I realised there was about a 6-month period where my hair was manageable. And that's because half of it had fallen out by then. But it was manageable. And I thought, this is lovely. It's really nice having nice hair and having a decent haircut. And it does something to your face. And it's a big integral part of women particularly, but equally men. And actually losing it was a really big problem because I was like, this is too young. I'm too young to be So I recognise the challenge it is. And so you will do anything to try and keep it. The problem is the anything worth it when the outcome could be something different? And if I was told that there was a pill that I could have taken every day that would have kept my hair, absolutely I would have taken it. You know, even though it might have caused a fertility problem in 20 or 30 years' time.
But at that age, you still said you're 16, 17, you'd know where you think about having kids.
Not at all.
Yeah.
Not at all. And I absolutely don't want kids now. But like, then I was like, oh, maybe I would want kids, but I wouldn't be thinking in, you know, decades' time that could be a problem, and that would be something I would worry about.
Yeah.
And I think there's, I said this the other day when I was at a fertility clinic, I think there's still this huge disconnect with men of what they do in their life, what they eat, what they drink, what they smoke, what they take, and what comes out of their penis in terms of their sperm quality. Do you think? I mean, you know, you see more of these men than we do.
Yeah.
They don't, you know, the cycling is the big one. Is it cycling and the beer? It's like, oh, she's told me to get off the bike. Is it really a thing? That there's just this huge disconnect, isn't there?
It's weird though, isn't it? Because like they've all read online that if someone eats pineapple and cinnamon, it'll change the taste of their semen.
Yeah, they're
beyond that.
But and absolutely we'll be hoofing down the Del Monte. Yeah. But actually there is no actual kind of thought, well, what about if I'm eating that pizza? Well, I'm not saying that obviously your Domino's is going to cause you to become infertile. What I'm saying is that actually if all of your calories are from from severely processed food, and there's very few nutrients that you're actually taking into your body, that is going to come out in your body shape, in the way that your body behaves, in your heart function, in your blood vessels, but also in the products your body makes. And if one of those products is seminal fluid or sperm or testosterone, whatever, you know, it's not going to go well. And but I think this issue needs to start at schools. You know, I remember. I mean, I was very lucky. I went to a school that had cooking classes. You know, we were taught to make a balanced meal, and that was incredible. You know, but we were also taught how to cook it. And so this is like I'm 10 or 11 and I'm doing this, and I'm thinking that's actually really helpful.
Was this in the UK or was this?
Yeah. No, I mean I was lucky enough to go to a private school, but they specifically set up a sort of kitchen next to the sports field, and actually every year went through this lesson where they just every few weeks they would just cook themselves a meal.
Although you do have home ec now or whatever they call it now.
Well, there's less and less, isn't it? Because lots of places have closed down their kitchens because it's why would you want home ec? And you're like, actually, knowing what to cook, knowing how to feed this body, which is a machine, and I think loads of men know about what sort of petrol or diesel they put in their car, right, and why 90 versus 95. I don't even really know. It matters in terms of oil or whatever that petrol
definitely
thing
matters with the Skoda.
Yeah. I know what needs to go in, it's fine, but I don't necessarily need to know what the numbers mean, right? I know what needs to go in that engine for it to keep it going, and I know there's a specialist that can do the MOT and stuff, right? But equally, if it's coming down to me, I don't get taught what should really be going in my body to actually make this machine work at optimal function. And if this machine is going to last maybe 80 years, maybe in the future it'll be 90 years, maybe 100, I kind of want it functioning for as long as possible, as well as possible. Because like what's awful is like the deprivation stats, and it's slightly off tangent, but like for men, men in Chelsea live 22 years longer than men in the least deprived part of Sunderland.
Good
wow.
God.
22 years.
That's an insane
which is
amount of
ridiculous, right?
Yeah.
And also, of those, so say for example, a man in Chelsea is living to their 90s, they will spend 4 out of, let me speak, they will spend 80% of that time in good health. Right. So out of those 90 years, lots of it will be in good health. Whereas those men in Sunderland, they will spend only 2/3 in good health. Yeah, so actually, they will spend a third of their lives,
which is already reduced,
reduced in chronic illness.
Yeah.
So actually, there are clear differences in terms of deprivation, education, and I get some people get very frustrated going, everyone can learn to cook. You're going, well, not everyone has the time.
Or the money sometimes.
If you're working 3 jobs to support your family, when do you have the time to make a lovely meal fresh from vegetables? Or do you buy the Happy Meal that actually has...
You get it instantly.
Exactly. Yeah, and my kids are happy.
Yeah.
I have no blame for that. I work in Stockwell, which is a really deprived area. It's one of the most deprived in London and one of the highest mental health things. And you're like, I have no blame for my patients who are struggling and who actually just are trying to hold it together. You're like, good for you for doing anything to try and keep your family supported, etc. But what can we do as a society, as a government, etc., to make that easier?
I think a lot of society's ills could be solved by better education around food, nutrition, exercise, money, wealth management, things like that. Because you don't get taught any of that. And within that, in the context of what we want to talk about here, fertility, health, mental health, all of that. If there was a better coverage of that within the curriculum and maybe a little less algebra, what's going to be the, we're not going to have a shortage of accountants, but we're going to have maybe a healthier society, less burden on the NHS. But
the other thing is about burden on the NHS. I feel that's kind of slightly a misnomer because you're like, I mean, I do think the NHS is this extraordinary institution, and it was set up for exactly the right reasons to provide health for everybody. And it should never be that you can't afford to look for your healthcare. I think that's absolutely unacceptable. But the fact that we have generated a two-tier system because successive governments have allowed the NHS to kind of open-eyed walk into mediocrity, and then sometimes it's not even mediocrity; it's just not working very well at all. I mean, and it's gone to the point where now I think the latest study was that significant proportion of people don't trust the NHS to meet their healthcare needs. They don't necessarily trust the ambulance to pick them up. It's faster to get in a cab than it is to deal with your heart attack than it is to call the ambulance, and that's got to the state where it's absolutely unacceptable. People pay a lot of tax in the UK. We're a very rich company. It's a not country, but actually it's also a company. We put money in, and actually there should be something coming out of it, and it's about the choices that people have made. People decided that actually hospitals should run like businesses. They shouldn't have so many free beds available, because why do you need all these spare beds? And then all of a sudden COVID happens, and that's why you need free beds, because actually it gives capacity when stuff goes wrong. And they're not just about COVID, for example. Because we run often at 95% bed capacity, that still sounds like, oh, you've got 5% beds. Well, but where are all the elderly people going that need social care and need nursing homes? Oh, but they've all closed because we changed the needs for these people. And we've actually decided immigration is terrible, so actually you've got no caregivers. So there's no one there to look after them. They have to stay in hospitals, and there's still people going into the hospitals. There's no wonder that there's queues out the door of a hospital sometimes, and that actually patients get stuck there for months. And, they get called bed blockers, and they're nothing of the sort. They're there because people have made decisions not to sort this out. And the successive governments have looked at social care and gone, actually, this is too big a conversation to have with the population. How do we talk about the fact that we need to fund our increasing old age population with something? But where does that something? Does it come from defence? Now we've got Ukraine and Russia, etc. Does it come from
nobody wants to pay for it, do they?
No, well, yeah, but also what do you cut? Like, I hate the fact we've got potholes in our road. We got a blown tyre the other day for going over a pothole, and you're thinking bloody council, but I'm also like, councils have been gutted, so no wonder they spend their money on schools rather than on if they can. Anyway, this is political rather than that. But but the problem is the political is personal and is health. The decisions that are made about us and for us have profound implications on our healthcare.
And is that hard for you as a GP when you're seeing patients in your practice and you're kind of knowing that all of this is going on, and like, how can I help? And like, say you're working in a very deprived area, like, how can I help these patients? What can I do?
Well, absolutely. Sometimes you're literally coming to see me, and we are going to nod and accept the fact that you have a terrible life and there is nothing I can do about it. So what we try and do is try and be more practical. So we now have social prescribers which can support with not the mental health that means that you need to see someone, but the mental health that comes from actually working multiple jobs and having no money and never having the ability to succeed because you don't have the time to think, and you don't have time to sleep, and you don't have the time to give the time to your kids that you want to.
The daily grind, basically.
Exactly.
Isn't it?
And people are so worn down by the daily grind, and all of this stuff about asylum seekers, it just covers the fact that actually a lot of our population are poor. And a lot of our population work really hard to get the bare minimum, and not even that. And actually, as a GP sitting there watching that, it just makes you so angry, which is why lots of GPs are leaving, because they're like, actually, why would I live in a community or in a country that allows this to happen to its people? And and we always have high hopes when a new government comes in, and the problem is, obviously, we've had 15 years of mismanagement, like the most severe mismanagement ever, and we are now trying to have a broken country rebuilt within a few years. And you think, well, what have Labour done in a year? Well, why don't I tangibly have improvements? Because
the problem's too big in the first
place.
Yes.
It's like you can't fix the fact that the whole house has fallen down. Like, what do? You do it brick by brick, but you still don't have a house. Like, it takes time and it takes money, and we don't have money, and we now need to spend more of our money on defence. So I know it's not easy, and I can't even imagine what it's like being a politician trying to go, I'm going to make this decision between funding healthcare and funding the protection.
I don't envy that at all.
And how does this play out with your fertility patients that you're seeing? So, and this might be in it's private practice, isn't it? But do you see similar issues with fertility patients as well?
If, for example, there is only a certain fund of money, right, a certain pot of money, are you going to want to fund all 3 cycles of IVF? You actually, let's say the NHS manages to do that for probably under £3,000 a go. If you go privately, it's £10,000 to £15,000 a go. So it's not like we're not able to do it at a really good cost. It's just that actually, why don't we just give them one go? Because we're still giving them a service, but actually, the problem is the chances of IVF succeeding are approximately 30 to 35% live birth rate with each go. So with 3 goes, that's probably reasonable. But with 1 go,
it's a shot in the dark almost.
it literally, isn't it? Yeah. It's like it's like a 3-sided coin. Like you might or you might not. And also, some of the tests aren't available in general practice, and lots of general practitioners don't know enough about fertility because we've never been taught it. It's not in our GP curriculum. So actually,
is male fertility not in the curriculum at all?
Nope.
Female fertility?
A little bit,
right,
but not significantly.
There's nothing.
Testosterone deficiency isn't.
That's not in the curriculum either. That's mental, isn't it?
Especially at the earlier part of this podcast when you were talking about how things are in decline.
Yeah.
You think that would be like quite a big prevalent thing.
Well, yeah. And when we were at that symposium, last year, Guidelines Live, and we were chatting to GPs, and you did that presentation on our behalf. But me and Mike were stood on this stand, and we're having GPs come into us like, "What do I do with semen analysis? How do I read it?
Yes.
What does this word mean?" And I'm like, wow, that's just mental. How do they? I mean, we have to respect and understand GPs need to know a little bit about everything because they are a general practitioner, so they can't know everything about everything. But like, my goodness,
I would genuinely consider that relatively basic. But the issue is, I consider it basic because I actually went away and learnt about it because I realised I didn't know about it. And the reason that we now have to know about it is because a lot of these tests, which are suggested or recommended by fertility clinics, are recommended to the woman about their partner, and then the partner comes to their GP to have that test.
Yeah.
And then the GP obviously having ordered that test, is then responsible for reviewing the result of it. But if you don't know what the test was done, and particularly why, and then how to interpret it, I mean, I've had patients come to me saying, "Oh, I was told that I was functionally infertile," and I look at their list and I'm kind of going, "But you've got like 60 million sperm and they all seem to be swimming in the right direction." Yeah, absolutely. Your percentage of like the right shape isn't brilliant, but actually, lots of people get pregnant on this. And he's been gone from a sensation of feeling, "Oh my God, my world's just fallen apart," to, "I'm shocked at what you're saying and I'm really angry that I was put in this situation." And I've got no blame for that GP, because actually I don't think you blame people when the way things are set up doesn't allow you to understand them. I mean, it doesn't mean you can't go and learn, don't get me wrong. But actually, if you didn't know you were meant to know about it, why would you learn about it when you've got to know lots of other things? If I've got to know more about your heart, because we're a very curative society rather than a preventative one, I'm going to much more know about hopefully picking up cancer signs and things like that once they've happened, rather than knowing about, how do I protect someone's fertility at 20?
Yeah, it's not high priority, is it? Or high enough priority.
And also, how many 20-year-olds are coming to me looking at fertility? None.
Yeah. So how do we fix it? What? God, that's a big question, isn't it?
Money and education.
Yeah, it's got to be education. It's got to be education of young people. It's got education in the medical professions as well, isn't it?
But equally, also people demanding more. We are a wealthy country. We can absolutely deliver more, and we can deliver it in a better way. And I think too many people have become too depressed and despondent because they're so used to ineffectual idiots running the country, who are more about ego than they are about actually service. And that's what it's in the phrase, right? Public service is about service. Yeah. It's like, what can I do for the people to make their lives better? And what can you do is you educate them really highly. You make them inquisitive. You don't just make them learn loads of stupid facts. And fine, they might be facts, but actually, what's your understanding of them? What's your ability to debate them? What's your ability to challenge? Like, I learned nothing about debate at all. All I learned was facts and how to pattern recognize. And actually, you have to be thoughtful. You have to go, okay, but someone has told me this piece of information. Is this real or not? But I can imagine why there's so much misinformation about vaccines, about testosterone therapy, about hair loss, etc. Because people are believing influencers over experts. But then when your experts sometimes are saying wacky things as well, which experts do you be? So I totally get why.
It's a lot of noise, isn't there? Yeah. Like, how do you decipher what's the right information? Yeah, it's difficult, isn't it?
Which is why this is great, because hopefully you've got a listenership that are more nuanced about the fact that we don't know everything about fertility. We don't know everything about testicule function. We don't know about all the drugs that could be causing harm. We don't know about the plastics in our in the stuff we heat our food up in. We don't know about our coatings on our pans and stuff. There's lots of stuff, pesticides, etc. We don't know loads of stuff. However, we still know loads, and there's lots of stuff out there to help you. And it just frustrates me that that's not the stuff that gets heard above the, just looks maxing, or how to get your third date if you ignore 3 texts in a row. All that sort of nonsense. Just does my head in.
Yeah, must be. So kind of you're kind of a bit of a man and a GP on a mission in some ways, that you know that you want to try and make this change. And
do you know what? I put my head in the sand. I have to be honest. I try not to read the news because I'm like, it hurts too much. It just makes me really sad. But equally at the same time, I'm generally quite positive. So it's quite like it's a weird thing. I've kind of been forced into this position of being slightly despondent, which is not my natural state. But at the same time, kind of like, okay, well, how do you fight that? And the only way to fight that is by talking about it, and by and so it's a delight to be here anyway. But equally, it is so vital to be talking about this stuff, because hopefully a few people will listen, and hopefully the sort of people that listen kind of then tell their friends.
Yep.
And if that extends, and hopefully the right sort of information, it's obviously, I know that's from my viewpoint, and your view, the right sort. I appreciate that varies for people from your viewpoint, but like if the correct sort of information gets out there, and more people understand that, maybe they'll be less accepting of mediocrity.
But I guess it's also like when you've got that couple or just that guy sat in front of you in your fertility clinic, you're like, okay, I can make a difference.
Which is lovely. And that's why I so love doing fertility, because actually I've had messages from patients and they come back to me and they go, we're pregnant.
Yeah.
And I'm just like doing backflip, like Carlton off the Fresh Prince of Bel-Air. Thank you very much. But it's just so amazing when they say that, and they are so happy, and the elation is very visible, and the astonishment, and and obviously there's the worry and the anxiety. Is it going to go the distance? Because I totally get, the joy of being pregnant is also the fear of being pregnant and what could happen to you.
It's complicated,
isn't it?
Especially after a fertility journey. Anyway,
Absolutely. And I don't know how you manage that 9 months or however long it is of insecurity, because I hate not knowing I'm going for breakfast, let alone what's not going to happen to potentially. No, exactly. And the problem is when you doctor kind of know how many steps it can go wrong at.
Yes, yeah, it's a horrible.
But equally, it is extraordinary, and so it's lovely working in parts of medicine that generally have positive outcomes. So in the testosterone group, they generally have a positive outcome. My erectile dysfunction people have a better outcome. The premature ejaculators tend to have a better outcome. The fertility people tend to have a better outcome. That's just the joy, because actually my GP day is often patients who are in distress that I can't necessarily do everything about. And that's not all of them, but that's like getting more and more people, and that's horrible for them, and it's pretty horrible for us. So
a complete rewind from where you first started out in your medicine world, right? What a difference how you've navigated your career.
Yeah, and I think it's still about not being miserable.
Yeah.
If I did, and that's why I think lots of people get irritated going, oh, well, GPs only work 2 days a week. I used to do 4. I can't do that anymore, because actually the job has changed. It's now about trying to support people in a world that doesn't have enough resources, or chooses not to have enough resources. Whereas before, actually, I could refer someone for their hip and they'd be seen within 6 to 8 weeks and they'd have a new hip. And at the moment it's taking a year. The problem is they're then coming back 10 times with their pain, the fact that they might need a housing letter because they can't get up the stairs to their flat anymore, the fact that that they may have lost their job because they can't do it. And actually we could have prevented And so that's the frustration. So that's why lots of GPs are kind of leaving or working fewer hours, because actually why would you work in a system that you can't do anything about?
Yeah,
that's a difficult conundrum, that, isn't it? Because obviously you enter that service to help people.
I hope so.
And if you can't completely do that because of the restraints you've got, it's difficult, isn't it?
Yeah,
mentally that's challenging. I think.
And I'm sure that's the case for everyone that works in a public service sort of job, right? I'm sure they have the same things as schools. I mean, God, having been a school teacher, absolutely. And I was lucky at a private school, but I have worked briefly at public schools, and actually the lack of resources and the stress that they go under, the fact that I've got teacher friends that are buying clothes and shoes and stuff for their kids and making sure they get fed out of their own pockets because it just isn't available to them. And that's the sort of stuff that I find really shocking. Why are we not supporting the poorest in our community? But equally, that's why I also mitigate it by kind of doing stuff that's amazing like this, and getting to go to conferences where you hear about the latest advances in fertility, and there is so much going on in the world that's exciting, and I think it's important not to let the misery drown it out.
And you've done some great work with the Royal College of GPs as well, aren't you, in terms of educational content for them?
It's brilliant. It's a great job to have, because you're kind of like we've got 7 hours of educational content. What do I think this year that and obviously it's like we get feedback from the previous years about what they want from, but equally we kind of get loads and loads of positive feedback going, like, I didn't really realise that men's health was this broad. I didn't realise it was hormones, and it was heart disease, and it was suicide risk, and it was mental health, and it was fertility, and all this stuff, STIs as well, or HIV. It's so much stuff. It's a real privilege. It really makes me excited.
Yeah. So where do you think you're going with your career in the next few years?
Oh, absolutely no idea. No, this is the usual path of no resistance. It's been random pretty much. I've never really had a program, so who knows?
Go with it.
Fair enough. All right, we'll get you back in a couple of years. And be like,
See where Anand is.
I know a horticulturalist.
That would be fun.
Yeah,
I like a garden.
No, we need you to stay in the fertility world. We need you in the men's
Maybe I'll
health
do that on
world.
Friday. I'll do that on Friday.
Yeah, because
Just keep
you
it
are
around.
such a strong advocate for men and men's health
You're
and
very kind.
male fertility as well now. So I think that's a good place to wrap up. But
Thanks for having me.
yeah, thank you so much for coming in. How do people find you? As in, professionally.
Generally charming.
this isn't about your dating apps.
They can find me on Tinder. No, if they want to go on Instagram, it's at Dr. DRANA.ND. Just because Anand is possibly like Andrew of the Asian world. So there's lots of Anands out there. Yeah, so it's at Dr. A. God, I can't say this. Dr. ANA.ND at.
No, that's it. Yeah,
That's it.
just your
We'll
Insta
chuck
handle.
it in the show
Yeah,
notes.
put it in the show notes.
Can you just make me really clear that I don't really do social media very effectively?
Yeah, I think you've just made that clear yourself.
But still, you're one of the coolest doctors I know. And
Yeah, sweet.
thank you for just being absolutely awesome in this space.
But also you can be
kind.
found through Jonathan Ramsey, can't you? Because
I
you
can.
work in,
Yes, so
in
no,
his
I also
clinics.
have my own website, dranan.com. I forgot that.
Just
yes.
a slight detail.
Or could dranan.com. Yeah,
Somebody get him a marketing manager.
Does
would
it,
they?
I know, this is why my agent finds me slightly terrifying because I'm very disorganised.
Yeah, excellent. Oh well.
On that note, we are.
Yeah,
It's all
on
good.
that note, book in to see Anand. He
Yeah.
might be
I'm
there,
not
he might
disorganised
not
at work. I'm just disorganised when it comes to my social media.
be there.
Honest.
Honestly.
Yeah. Brilliant. Thank you so much for your time. Thanks for
Thanks for having me.
driving all the way up to Reading. It's a long, long way.
It's a very easy drive. Delighted to be on such a sunny day.
Yeah. No, brilliant.
Safe trip home in the Skoda.
Thank you. Yeah, thanks.
Cheers. Take care, everyone. Bye-bye.
Bye.